Good afternoon, ladies and gentlemen. Thank you very much for coming here to listen to my presentation. I come from United States, California. I started learning Chinese medicine since year 1967. So before I come to the United States, I worked in a very big teaching hospital in TaiJi. I work in the ER, emergency room. So I both practice Chinese medicine, Western medicine, and acupuncture. So my topic today is just like Dr. Lin and last doctor talked about cancer and the cancer pain. And I have some very new hand and method for like TaiJi, golden ratio acupuncture, and the case study. So today a lot of things I have to talk. So maybe I speak more faster. Anyway, we have some Chinese, you can see that. And you have any question, after that, you can discuss with me. And I have another workshop, 4:30, in the room, Toronto AB. So you can continue. Totally, you have 10 cases. But this presentation, I have 5. So you can see it is very, very severe cancer pain, late stage, and severe pain. Even use morphine cannot stop that. But use acupuncture, make patients really relieve and snoring for sleep. So we have chapter, total like 5 chapters, but you already see it's not necessary to read because so many things to talk. So chapter 1, cancer and cancer pain. This is very complicated and most difficult problem all over the world. Cancer kills so many people, destroys so many families, but till now, just like doctor said, for late stage cancer, we can do very limited. The mechanism of cancer is very complex. The accumulated result of variety of multi-step cancer gene activation and inactivation of tumor suppressor genes. So there is a very important thing, is the cell signal transduction act like GPS. So that will guide gene expression. But if these systems have something wrong, a big disaster happens. The cell will lose control. So we can see we try many things. Chemotherapy, surgery. Surgery is good for early stage. But later, if second stage, third stage, fourth stage, you cannot do any surgery, already metastasis. And chemotherapy, radiation, like immune therapy, even plus some acupuncture and herbs, but we still cannot find the final solution. So we need working together, do more effort, do the research, just like Dr. Lin, and more doctors together to find some special way. But my key point is, from your own human beings, very difficult to do that because the signals transduction, the signal comes from the universe. We have to how to readjustment. So already talked about that, like GPS. So if we have good car, but GPS something wrong, you may drop to the ocean, you may drop to the cliff. Cancer cell like the same thing. So epigenetics, reason find in epigenetics contradict the traditional concept that DNA is the main determinant of cancer. The latest research shows that change in the internal environment of the human body and the cell signal transduction mechanism are instrumental in deciding and make the gene expression take the good direction. So this is say how complicated. The gut signal from outside enter the membrane of the cell and enter and in charge, guide the signal for gene expression. This is so complicated and multiple connection, multiple communication. And the speed so fast, like every second maybe a couple hundred times, even 1,000 times. So very difficult to make everything under control. That's why so many people be killed by cancer even in the middle age. This have some my case. This is my really successful case. This lady, the white lady, she got pancreatic cancer. At the very beginning, start year 2011. She got severe pain and go to hospital check, the Stanford Hospital. They finally found she has pancreatic cancer. And they did surgery for her. It's pretty successful, like a WAPO operation. And then she felt pretty good for 2 months, and 2 months later, the symptom gradually back. And she come to see me. I start treat her. 3 times later, she feel better. I use TaiJi golden ratio acupuncture. And then 2 years later, she feel pretty good for 2 years. And then she's very close friend died. And she crying for 2 nights, cannot sleep. All the symptoms come back. So she went to Stanford Hospital again. They tried to do the surgery, but surgery failed. So doctor said, oh, sorry. And she came to see me again. So I gave her treatment, use TaiJi golden ratio acupuncture. She feel pretty good. So right now, every 2-3 weeks, she come here, like a rechargeable battery. Right now, she feel pretty good. So this is my, I will repeat that later, because the time limited. So this is like a, you can make picture for that. Big position, the bed, ensure the patient's ren do ring parallel with the plane of the earth and the sun. And then use the acupuncture. I found like 2 new zone, like new cerebellum zone, new hippocampus zone, and use the acupuncture like the third part. This is the patient. Last year, this picture. I gave her my book, like English copy. She visited me like 3 days ago. She feel very good. She's a teacher, working in the library, school library. And second two, this is the late stage for colon cancer, colorectal cancer, 3 lymph node, and liver metastasis. So this is during the treatment. First time she came here, like year 2015, January. And then this April, this August, this is the latest. You just gave her picture. So she feels very good right now. But before, she has severe pain. And she goes to hospital. They say, oh, you have the disc herniation, L4-5. So do the surgery. But after surgery, the pain's still there. They make more tests. They found she got 4-stage cancer and metastasis in the liver. And then she started use the chemo, radiation, whatever the method you can name. And then she's still so painful. And finally, she come to see me. So I start treat her till now. The pain reduced like 80%, and the metastasis, the lymph node disappear, and the liver metastasis, even use the chemo cannot control, but right now start to reduce. Especially her CEA reduced. You can see the start treatment, and then till now, September 1st, year 2015, remarkably dropped. So her doctor feel very surprised and very happy. And case 3, this early stage for uterine cancer, cervical cancer, and colon cancer. It's the very beginning, year 2009. She got a problem like abnormal big bleeding and some abnormal tissues, and she went to ER, and they said, oh, biopsy show you have early stage cancer, you have to do surgery. But she is very traditional Chinese lady. She refused to do the surgery. She said, if I do surgery, I'm not a lady, because all the uterus, ovary, they take off. So she want to try acupuncture. So she come to see me, and I give her treatment. And then later, year 2012, year 2013, they consider she has another cancer. That I use acupuncture, and especially this golden ratio TaiJi acupuncture. Right now, she feels very good. This is early this month. So this is evidence. The first time I gave her treatment, and then 2 months later, she went to hospital. She said, oh, you have to do surgery. They said, oh, check me first. They do biopsy, send 3 different labs. Because first lab, they say, oh, nothing wrong. And then they double check to send to another 2 labs. And they say, oh, everything fine. This is a letter. And it is the hospital gave her the congratulation letter because everything normal. This year, 2013, year 2015, April and July. So right now, everything's fine. Disappear, but no any chemical like chemotherapy and radiation. Just this acupuncture really clear her. So the case 4. This is an old lady from Taiwan. She's very beginning, year 2012. This is 2013. She got severe pain and cannot walk, cannot pee. So she went to hospital. Hospital check. They say, yo, you have gallbladder cancer, bladder cancer, and pelvic metastasis. That's why she cannot walk. When she walk, maybe 5 minutes, she have to sit down. It's so painful. Even use morphine cannot control that. Only drop the pain from 9 to 5. And then she come to see me. I use this TaiJi golden ratio acupuncture treatment. You was wondering what TaiJi golden ratio. I'll explain later on. But first give you some very difficult case. You think if the patient looked for you, how do you treat them? But for her, see, I start treat her like this year, March 27. And then a couple times later, she said, feel much better. And go to April 29, the hospital check, everything is normal. And the pain disappear. Right now, she can walk with her daughter for 2 and 3 hours. The pain reduced like 80%, 90%, like a change. Depends how many hours she's walking. So you can see, you can compare. If even you never learning about acupuncture or Western medicine, you can see the face color, big difference. Dr. Wang is the expert. She will talk about, right, the face diagnosis tomorrow. Okay, the chapter 3. What is the TaiJi golden ratio acupuncture? The concept of union of the universe and man as a whole is based on the ancient Chinese philosophy and traditional Chinese medicine, theory and knowledge, the cutting-edge research in the life sciences. So I try just like combine different research, modern and Chinese medicine. I found all our human beings' structure, rhythm, come from the universe, resonance. So this is my book. This picture I made in the Vietnam, in Ha Long Bay. So this book was published in Taiwan year 2012. So the TaiJi golden ratio acupuncture is based on the objective view of the universe TaiJi energy field. It triggers various corresponding aspects of the energy field resonance, activating the body's deep-level self-healing system to better recover from the internal environment disorder of the human body and optimizes the cellular signal transduction system. This leaves patients of cancer and cancer pain with varying degree of improvement, thereby advancing the quality of life of patient and prolonging life. You can find this book maybe later in this workshop. But this, I'll talk about the new cerebellum activity soon, like a workshop. But this is part of the TaiJi golden ratio acupuncture. An introduction of the TaiJi golden ratio acupuncture. Actually, this have totally for 16 parts. This is my many years research. Finally, I found, oh, this way really help. Can wake up patients' very deep layer self-healing system through the human being and the universe, TaiJi golden ratio energy resonance. That's really help. Just like last I talked about 4 patients, 4 cases, and I will have another case. So, number 1, fundamental of the universal TaiJi energy field. Number 2, fundamental of the universal TaiJi golden ratio energy field. Number 3, universal TaiJi golden ratio energy field is the foundation of the human biological TaiJi golden ratio energy field. This is a yellow empress, canon internal medicine. This Huangdi Neijing is translated by my father and me and published almost 20 years ago. The Huangdi Neijing state, the energies of heaven and earth combine to form human beings. My proposed mechanism has drawn a close correlation between astrology and the core TCM theory. The human body has various TaiJi golden ratio structure accompanied with the biological energy field. The golden ratio instruction, distribution of the important acupuncture point, the rhythm of the qi circulation in the human biological energy field, and the internal environment of the human body are all essentially related to the universal TaiJi golden ratio energy field. This proposition has addressed the resonance between human, heaven, and earth. Number 4, during acupuncture, the doctor used the power of salts along with the needling to corresponding of the TaiJi energy field signals. This would be stimulate certain acupuncture point in order to integrate the strong TaiJi energy field resonance effect and regulate the circulation of the qi, which is effectively improving the patient's self-healing capabilities. Number 5, along I Ching principle and the biological and the TaiJi energy field, depending on the patient's situation, the doctor can effectively choose the corresponding acupuncture point and the order of applying the needles. Number 6, follow the Huangdi Neijing, circular motion energy field theory is instrumental in deciding the acupuncture point and the order of applying the needles. Number 7, according to the yellow Neijing, Huangdi Neijing, so 1, choose the corresponding source point to trigger the universal with biological energy field resonance through, first, the circular motion energy field resonance, and second, the TaiJi golden ratio energy field resonance. Say, resonance, very, very important, but between human being and universe. So how can we do that? The Huangdi Neijing already talked about that. And number 7, according to Huangdi Neijing, number 8, utilize the rhythm of the qi circulation of the 4 seasons, 12 period, 2 hours in 1 period, and choose the 5 shoe point corresponding to TaiJi golden ratio acupuncture depending the patient's situation. Number 9, Lianshan Yi A trigonogram theory choose the acupuncture point according to umbilicus to trigger the TaiJi energy field resonance effect. Number 10, the TaiJi golden ratio energy field method choose acupuncture point along with the application of the massaging to trigger the circular motion energy field resonance effect, optimally regulating the circulation of the qi. Number 11, applying of the brain sciences and the new cerebellum zone scalp acupuncture. Number 12, application of the brain sciences on the new hippocampus zone scalp acupuncture. 13, this is very important, optimizing the acupuncture treatment with the power of the thought from the doctor. According to the Huangdi Neijing, the needle are combined with the power of the thought from the doctors is highly effective in treatment. It could bring an unexpected catalyzing effect of treatment. Number 14, applying the Neijing 5 Yun and 6 Qi theory, we can better analyze patients' ancient Chinese astronomy-related health situation and symptoms. Furthermore, focusing on the specific acupuncture point for more effectively treatment. Almost done. Huh? Number 15, applying TaiJi energy needling in the direction of the Earth's revolution in the TaiJi S-curves pathway to circulate qi with the human body can effectively provoke the patient's self-healing capabilities. Number 16, use herbs. Okay, this is a golden ratio acupuncture fundamentals. We see this is a resonance. There's a bad resonance, a good resonance. Will cause some like print in the tree, and some print you are human beings. So this is like sun. We can see every day, morning, evening, like cycle. 6 o'clock, 12 o'clock, 18, 24. But we can change to like sine wave. And then every day like that, we got like TaiJi yin-yang picture. And the same thing for the sun, Earth around the sun moving. And we can see the same thing in the moon. We can got same picture. So this TaiJi, we got some resonance to our human being, like chromosome, or spine, or DNA. And left side control right side control left side. This S shape comes from TaiJi. And this golden ratio. How come we got golden ratio? But golden ratio right now not only 0.618. This is like some area from 0.6 to 0.7. This comes from the universe. How come? Actually, you can see, due to the complex changes in the Earth's orbital motion, a various cycle for each 41,000 years, obliquity change interval have 3 ranges of angles. The obliquity of Earth determine the location of tropical of Cancer and tropical of Capricorn. So that's why we got this number. And we can find, because our Earth around the sun moving, then the far away and close away, they have 5 million kilometers different. See? It's rotate like that. So that's cause this line, this picture there, every 7-8 days, you same place, same time, make picture for light, for sun. We got this kind of picture, like people's meditation there, but we got like ratio there. This is golden ratio. And same thing, we got golden ratios, the print, you are human beings. S and golden ratio. Actually, it's a very important point I mentioned before, that located in the golden ratio area. So we got conclusion. So the case studies above is a very complex case. but use the circle motion energy field resonance along with TaiJi golden ratio energy field resonance for acupuncture treatment is surprisingly effective. The procedure. First, position the bed. Ensure the patient's Rendu ring is parallel to the plane of the earth and the sun. And second, appropriately using new cerebellum zone and the new hippocampus zone scalp acupuncture can activate the TaiJi energy field resonance because these two zones are located on the golden ratio region. And we can see the Ren meridian is 2 meridian. It's 2 to 3rd, see? And one face to sun and earth, they will got resonance. And wake up deep layer self-healing system. The Rendu ring follow the direction of the Earth's revolution. It's marked from the universal TaiJi energy field. The ratio of Rendu is about 2/3, which is a golden ratio. When the patient's Rendu ring is parallel to the plane of the Earth and the Sun, it's very important. The resonance of universal with biological TaiJi golden ratio energy field is effectively triggered in provoking patient self-healing capabilities. And then, you can see that? Look at a big picture, huh? And then, third, apply needles with the power of the salt in order of the left, liver 3, pericardial 7, right side, lungs 9, kidney 3, and left side spleen 3. Then follow with other acupuncture points depending on the patient's position in the direction of the Earth's revolution and the TaiJi S-curve pathway to circulate qi within the human body. This is to integrate the strong universal vs biological TaiJi energy field resonance effect in provoking patient self-healing capabilities. We can see that this left side, first liver, second heart, third lung, fourth kidney, and then spleen, and then we can see it's a start. And it causes resonance with the universe Neijing talk about from liver, heart, lung, and spleen, and the kidney. And the spring, summer, autumn, and winter. This is a cycle. And then we have some indicator. How do you know you got the resonance? So when really patient got the help, the first patient upper back feel very warm. Second, I feel cooling. Third, the right side, the kidney one got like cold energy blowing out. But very important things, the patient pulse will getting more harmonized, and patient pain will big relief. So almost done, huh? This is the last one. This patient is a lady, only 40-something, but she got very beautiful young daughter, only like 4 years old. But one day she got very heavy pain, and she go to hospital. She said, oh, you have 4th-stage stomach cancer. It's so severe. You have to do surgery immediately. They say, oh, you cannot do surgery. They say, oh, you no surgery, only can live about 2 months. And then she started use chemo, but make her severe vomiting, severe pain, cannot eat, cannot sleep. And she looking for me, treatment. And then this is her situation. Then I use the acupuncture, really relieve her pain, relieve her symptom. She can sleep, she can eat, even gain weight. The very beginning, doctor said, oh, you're dying. But right now, doctor said, oh, you're looking very good. You can compare here. See? Big difference, right? Nobody can say she has problem. So, almost done. Again, I state how to treat the patient. I tell you everything. So, first, position the bed to ensure the patient's Rendu ring is parallel to the plane of the earth and the sun. Second, scalp appropriately using new cerebellum and the new hippocampus zone scalp acupuncture. Number three, applying needle with the power of thought of a doctor in order of left side liver 3, precardial 7, and right side lung 9, kidney 3, and left side spleen 3. All this is a sore point, right? Okay, finally, this is a key lecture. So finally, let me say, this is my student help me write that. Dr. Wu started than me, began studying Chinese medicine nearly 50 years ago in 1967, especially with the last 25 years of practicing medicine and acupuncture in the United States. He has come in contact with many patients with difficult ailments, read thousands of books, and experienced both failures and successful to realize and develop his methodology. It means to be universally applied toward the most difficult of disease, especially for those suffering from cancer and cancer pain. He, warmly welcomes and feedback or suggested improvement of his method. Hopefully, this advance can bring more benefit to a greater number of people suffering from illness. Thank you very much.